Hey class, welcome back. Welcome to week 2. This lecture is going to really be covering chapter 3 in your text. So let me get started here. Okay, so this is for those of you who've already had anatomy and physiology, this will probably be review. For those of you who have not had any anatomy and physiology yet, this will be new and maybe take a little bit longer to absorb all the content in this chapter. Okay, so so what we're going to be talking about today is how sounds are produced. We're going to be reviewing the different systems that are used. So our respiratory system, our laryngeal system, and our supralaryngeal system. We're going to talk about different terms related to the anatomy and physiology involved in speech production, and also identifying landmarks in the vocal tract. And since this is a clinical phonetics class, let me just explain the significance of why this is so important, especially when we start talking about speech sound disorders and we're trying to understand what type of errors a child is making, or an adult for that matter. Um, we want to really understand the sound that is the target as well as the sound that the child's producing and what is it that they are physically doing. So, for example, if they're substituting one vowel for another, they may be producing the sound with their lips retracted when they shouldn't be, or their lips rounded when they shouldn't be. Let's say they're producing a consonant with their tongue too far forward or too far back. That's also going to distort how the sound should be produced. So we really, when we learn about phonetics and the IPA, you'll see that we categorize sounds based on how they're produced in the vocal tract. And that will make more sense as we go through the units on the vowels and the consonants. But I just wanted to make sure that you understood what was so important about this. Also, if you're a speech therapist, you're working with people with sometimes with voice disorders. So learning about how the vocal tract works is very important because when we're assessing someone, we're listening for their voice quality. That's part of a proper assessment is to do what we call an oral mech exam and look at someone's jaw, their teeth, their tongue, mobility of the tongue. And we also look at their breath support. Are they able to sustain, do they have enough breath support to sustain sounds, for example? So this becomes very important when we're doing assessments of patients or students. Okay. So just to give you an analogy, and I believe this analogy was also in your text, is the vocal tract is somewhat like a trombone. Okay. So I don't know if any of you ever played an instrument. I used to play the tenor saxophone. That was my instrument. My twin brother played the trombone, and my younger brother played the trumpet. So we had a very loud house. So if you've played a musical instrument, then some of this will seem familiar to you. So we need power. And on the vocal tract, power comes from our lungs. That's where breath comes so that we make sounds. So, for example, if we're making the puh sound, we pucker our lips and we blow air, and that causes a sound. When we're saying vowels, it causes if you put your hand on your vocal cords, it causes your vocal cords to vibrate. Um, and when we make different sounds, so for example, when we're making sounds with a trombone and you're moving that slider, it changes in pitch, right? From low, low, low to lower. Similarly, when we are making sounds, we are changing, almost like sliding, we're changing the tract to go from either low to high or high to low, especially when we're talking about vowels, we think about this. So it is very similar to speech production when we're comparing these types of musical instruments to how our vocal tract works. So just to kind of go through very high level what happens. and how the airflow contributes to speech is it comes from our lungs. It goes to vocal folds. So vocal folds are vibrating for some sounds, but not others. Comes up through the pharynx, which we're going to talk about. We're going to be talking about all these different parts in a minute. And then comes either through our mouth or our nose. So certain sounds, the air is coming through our nose, so nasal sounds, but all other sounds were really coming, the airflow is coming through our mouth. Okay, and we're going to talk about the comparison in a few minutes and what's actually happening between those different types of sounds. Um, we're we're going to talk about our vocal folds and exactly how they work in a few minutes. And we're going to talk about what we call our supralaryngeal vocal tract. So that is really what we think of as everything above our vocal folds here. So our jaw, our lips, our tongue, our nasal cavity. That's supra meaning above. These different tubes that we're talking about will change their size and their shape depending on the sound that we're making. Okay, so let's get into it. Okay, so this is a sagittal, meaning a side view of the vocal tract. So we have our nasal cavity, we have our oral cavity, our mouth, we have our pharynx, which is really our throat. Um, our larynx is our vocal cords. I'm wearing a turtleneck, so a little difficult for me to feel my vocal cords moving. The glottis, we're going to talk about the glottis, which is the space between the vocal cords in a minute. Our trachea is our windpipe. We think of this as helping us breathe, right? And then our lungs below that trach. So, first thing that's important to be able to speak is to be able to breathe. And in English, in most languages, we are talking on egressive breaths. So the exhaling rather than inhaling, which would be ingressive, sorry. When we start to speak, our vocal folds are set in motion by what's called pulmonic airstream. So pulmonary is referring to our lungs, okay? So that is where our energy is coming and able to speak. And then as that air is coming up from our lungs, okay, and maybe putting our vocal folds in motion if it's a voiced sound, the next thing that happens is our articulators are going to change what is called the resonance of the sound. So, for example, if I make the sound, oh, it's a very low, deep sound, right? Versus the sound, ee, which is a very high sound. So how my articulators changes the pitch of the sound and how we hear it, right? Okay, so a respiratory system, and I'm going to show you a diagram in a minute, includes our lungs, our rib cage, our abdomen, our muscles. My speech therapist, we often tell kids to sit up straight. It will help you have more power to speak, especially for kids who may have, for example, I worked with a little girl who had a syndrome, and it was very important for her to be properly positioned because she did not have a lot of breath support. So again, our power supply comes from our lungs. If you've ever seen someone choke, if they're accidentally choke on food or liquid, they cannot speak. So recently we were at dinner and my husband was choking and I said to him, "Are you okay?" And he said, "Give me water." And I went to get him water and he said to me, "You didn't move quick enough." And I said, "Well, I knew you were okay because you were able to speak." So if someone is really, if their airway is obstructed by a piece of food, they are not able to speak. And in that case, someone usually jumps in to do the Heimlich maneuver. Okay, so this power, this airflow allows us to control our speech. So we were talking about whether it's coming through your mouth or through your nasal cavity. So if you tried to make the sound and then you held your nose, you won't be able to make the sound because that sound is made through the airflow coming through your nasal cavity. Okay, so this is just a diagram of the respiratory system that we just talked about. So again, our lungs are providing that airflow and coming up through eventually to our supralaryngeal system, which is our articulators above our vocal folds. As I said, we in English and most languages, we have an egressive uh, airflow when we're speaking. So you can remember E is for egressive, air is moving outward when we speak. Ingressive is air moving inward. And this is somewhat rare in languages, but sometimes there may be a particular sound in a language that's ingressive. So there's a video here if you're interested in watching it. There's some Scandinavian countries who have a sound that's ingressive, and it's to signify that you're listening to someone or that you agree with them. So it's entertaining. You can watch that. There are other countries who also have ingressive sounds. I think that your text mentioned that there's clicks in some African languages that might be on an ingressive breath. But for your purposes, you just need to know egressive because we're studying English phonetics here. Okay, so very important, and we'll be talking about this a lot as we get into vowels and consonants, is our vocal folds, so our larynx. So as you can see in this diagram, um, your your vocal folds are very close to your thyroid. So I've known several people who unfortunately had difficulty with their thyroid and had to have thyroid surgery, including my dad had to have his thyroid removed. And it's kind of scary because it is so close to your vocal folds that you have to be very careful when someone does the surgery that they don't actually damage your vocal cords. So I'm not going to play this video. You can watch it on your own. This is going to show you live what it looks like, your vocal folds moving during speaking. But what I do want to talk about is just some of the um, anatomical terms that are associated with this part of your anatomy. So the glottis is the space in between the vocal folds, okay? The epiglottis is what closes over your trachea when you swallow to prevent you from choking, from aspirating, we call it in technical terms, making sure that the food goes down your esophagus. Okay, so that's what the epiglottis is. The glottis is that space in between the vocal folds. So let's look at what happens, what are the steps when we make sounds. So air, that power is coming up from the lungs. And what happens is it causes pressure to build up underneath the vocal folds. So if you look at this diagram, if your vocal folds are closed, and then that air pressure comes up, it pushes the vocal folds open, and then the air pressure drops, and then they close again. Okay, so this is happening extremely quickly. So 1/100th of a second. So this diagram is showing the steps, but this is happening very quickly when we are actually speaking. This is a spectrogram, and we're going to be looking at this in class as well. We use spectrograms sometimes in speech therapy to help children visualize their sounds. We call it biofeedback, and it's really often used in clinical settings, so in a hospital or in a speech clinic. It's used for research, but you can actually download programs for free and use it yourself. And it can be very powerful to see how this spectrogram changes as you change your sounds. So just to kind of give you an idea of what this is showing. So what this is showing is on the x-axis is time, and then on the y-axis, it's measuring fundamental frequencies, okay? And your book talked about different fundamental frequencies, and we're going to talk about that a little bit more as we get into vowels and consonants. But fundamental frequencies are measured in hertz, and that should sound familiar to you if you've been studying speech at all, or if you've taken an audiology course, for example. We often talk about hertz and the different sounds that are measured in hertz. Now, when your vocal folds are vibrating, this is going to be perceived as pitch, whether the pitch is higher or lower. So if we talk about pitches, it's going to be different depending on the person. So males speak at a lower pitch than females, and children speak at a lower pitch than obviously adults. So lower pitches are when the vocal folds are slower in vibrating, and higher pitches are produced the faster that the vocal folds are vibrating. So babies are, as your text mentioned, their vocal folds are vibrating faster than anybody else. But eventually, as we get older, that slows down. Okay, so we talked about our respiratory system that gives us breaths. We talked about our laryngeal system, our vocal folds. Now we're going to talk about the supralaryngeal system. So your supralaryngeal system is everything above your vocal folds that's involved in speech, okay? And this is what's going to change the different sounds, okay? So once that airflow gets up past your vocal folds, how your articulators are changed is going to change the different sounds. So if we look at this very detailed diagram, everything above your vocal folds. So looking at the epiglottis, the tongue, and I always like to look at this because we don't think of how massive our tongue is in this system, but as you can see, our tongue is massive. It's a massive muscle in our supralaryngeal system. Our jaw is involved, okay? So when we are measuring sounds, we're going to talk about this in class. How many times our jaw moves gives us an idea of how many sounds we're making. Our oral cavity is important. So when we do, I mentioned before, an oral mech exam, how our teeth are structured, our palate. So children who have a cleft palate, that can affect their speech. And then our nasal cavity. So if you have a cold, it affects your speech, so you sound more nasal. Our adenoids, if we're moving back in this, sometimes someone's adenoids get inflamed and they have to have surgery and have them removed. That is going to change your vocal quality and your ability to make sounds. If we look underneath this, where the adenoids are, over to the left, the velum. So let's go from the front to the back. So if we start, you take your tongue and you put it behind your teeth, you'll feel a little bony area. That is your alveolar ridge. And then if you go a little bit further back, you're going to feel your hard palate. And then behind the hard palate, a little bit further back from that, is your soft palate, which is going to feel fleshy. Okay. So when you go to the doctor and he tells you to say ah, and he looks in your throat, the piece that's hanging down is the uvula. Okay. So in this diagram, you'll see the uvula is that piece that's hanging down. So velum is another word for your soft palate. Okay. All right. So let's talk a little bit about this. So uvular is the back wall of your pharynx, of your throat. So as I just said, velum is another word for your soft palate. Now, what's happening here is this is opening and closing to allow airflow into your nasal cavity, okay? It's called the velopharyngeal port, and we're going to talk about what happens if that's not working. This velopharyngeal port is opening and closing between your pharynx and your nasal cavity, okay? So we talked about nasal sounds are made differently. The airflow is different than non-nasal sounds. Your pharyngeal walls are also important for opening and closing this velopharyngeal port. So this becomes very important when we talk about someone who has what's called velopharyngeal insufficiency, or VPI. So this is someone is born with a structural condition where their soft palate fails to seal against their throat, their pharynx during speech, and that causes air leakage through the nose. So what you would notice if someone has velopharyngeal insufficiency is they sound very nasal, like when they're talking. We call it hypernasality. and they often have difficulty producing consonant sounds because they don't have enough airflow to produce the sounds. It's often associated with cleft palate disorders, and sometimes if someone has their adenoids removed, it also causes VPI. If you want to hear an example of what speech would sound like, you can click on this video. Operation Smile is an organization that works mostly with children who have cleft palate. So you'll be able to hear what the voice quality sounds like when someone has this, if you want to watch that video. Okay. So as we were just saying, for sounds that velopharyngeal port raises and closes, okay, except for the exception of nasal sounds where that stays open. So again, if someone has a problem where their velopharyngeal port isn't working, they are going to sound very nasal. Okay. Continuing on with our supralaryngeal system is our jaw, and our jaw is very important. If you ever take training, advanced training, to help children or adults with motor speech disorders, so there's a few different types of training programs that are pretty popular. One is called PROMPT, and another one is called dynamic temporal tactile cueing. So these two different motor speech methods, which are used to treat people, often for children with childhood apraxia of speech, which is a motor speech disorder, they focus a lot on the supralaryngeal system and the jaw. And I would say that other articulation methods don't necessarily talk about the jaw, but if you ever take that training, you will definitely be talking about the jaw, which in technical terms is called the mandible. So this supports the movement of your tongue and your lower lip. And if you've ever seen like a movie with a skeleton, this will kind of seem easier to imagine in your head. So it moves like in a hinge-like motion from what's called the temporomandibular joint. Okay. And your jaw has quite a bit of flexibility. So if someone, again, has a structural disorder, so when we do that oral mech exam, we're going to be looking at someone's jaw. So sometimes someone may have an underbite and their jaw is protruding. That can affect their speech. Okay, so as I said, the tongue is massive when you look at it in that diagram. And we're going to look at an image kind of labeling all these different parts, but just to go through it. So the body of your tongue is most of your tongue mass. This is very important in when we talk about vowels, which we're going to talk about in our next video. The tip of your tongue, this is also important for different sounds. So if you think about the th sound, we are moving our tongue between our teeth. If you think about the blade, it's just behind your tip. So like cheese, make that sound. The center, so the center of your tongue is coming close to making contact with the hard palate. If you make a sound like sure, you feel where your tongue is. And then the dorsum is what we are using for our what we call the back sounds, which this will make more sense when we start talking about consonants, but a sound like k, you could feel it's a back sound, k. And then the root is what's forming the front wall of our pharynx, of our throat. So again, if you look at the major landmarks that are labeled here, you have your tip of your tongue, so the very front of your tongue, then the blade, okay? Then moving backwards, you see the root is all the way there by the pharynx. Okay, so our lips are important for our bilabial sounds. So if we think about a sound like pop, right? You can see my lips moving for pop, right? Or a sound like ba ba, right? Those are what we call our bilabial sounds. So our lips are very important. They're important for rounding as well. So certain sounds like our vowels, ooh or oh, our lips are rounded. So they're also very important for the resonance of certain sounds. So if just to kind of summarize, we have we talked about the tongue and the lower landmarks. Our upper landmarks are really talking about the soft palate where we're making contact or the hard palate. um, the soft palate, also called the velum, and then our teeth and our lips. So this is very important when we start talking about consonants. You'll see that we categorize our consonants based on the place of articulation. So I'm not going to go into detail, but you will be definitely learning about this and memorizing it when we get into consonants. So just to summarize, air comes from our lungs. It next comes to our vocal folds, which vibrate for certain sounds. And then all the resonance comes from our articulators, which could be our lips, our tongue, right? The oral cavity and your nasal cavity for your nasal sounds. Okay, I look forward to seeing you in the next lecture. Bye.